welcome, Hotep. Good to see you all. I'm so glad to have you all participating in today's Matters of Diversity with Dr. B. We have a really great show for you today, and I'm looking forward to having a conversation with first-year doc students out of the counselor education program at the University of Central Florida. And so before we get started, I want to give another special shout out to the UCF Foundation Office, who are our proud sponsors, and so excited about having them be a part of this experience as we continue to kind of broadcast to you all some of the great things that are happening at the University of Central Florida and beyond. So my first guest today, we have four of them coming out of the counselor education program. My first person I'm going to introduce to you all is Sheldon Aaron. Sheldon is a master's level student who has his LPC. He's an NCC, which is a National Certified Counselor. And he's a doctoral student in his first year at the University of Central Florida. He has practiced as a counselor in Illinois for the last 2 years in his private practice and in the university setting. Sheldon's clinical practice has afforded him the experience of working with acute and chronic mental health concerns such as personality disorder and psychosis related disorders, advocacy and practice with underrepresented populations, and experience working with children, adults, college-age students in developing and implementing coping strategies and wellness strategies as they move through life and societal transitions. As it relates to Sheldon's clinical experiences, his research interests, academic involvement are centered in student development, advancement of cultural humility and sensitivity when working with students and clients of color and students and clients who identify as LGBTQIA+, and the advancement of professional standards of care with these populations. Next up is Ms. Tianka Farrow. She also is a master's level student. PPS is a first year student here in our counselor education program. The majority of her clinical experience has been serving as a school counselor in the southern region of California in the K-12 school system in a post-secondary institution. Tianka has developed and implemented social emotional learning curriculum at the middle school level, as well as acted as an academic advisor for the Dreamer and the first generation college student engaged in a TRIO program at the post-secondary institution. Due to her experiences, Tianka's research interest centers on cultural identity development, group counseling, school counseling, counseling interventions, improving self-esteem, and academic success, primarily among marginalized communities, multicultural counseling, support systems for dreamers, students, and allyship. Additionally, Tianka has served as a committee chair on various committees for the Association for Multicultural Counseling and Development, and presently she is the membership chair of that organization. Bethany R Russell is up next, and she's completed her master's degree in mental health counseling here at UCF with an emphasis on play therapy. She's a registered mental health counselor, intern, nationally certified counselor, and a certified child life specialist. Her research interests include Adlerian play and therapeutic interventions with children who have faced trauma and the impact of chronic illness on mental health of children and adolescents. Currently, Bethany serves as the Assistant Director of Research for the Center for Play Therapy, as well as the Graduate Assistant for the Community Counseling and Research Center through community outreach. Bethany is an active member of American Counseling Association for Counselor Education Supervision, Association for Child and Adolescent Counseling, for play therapy, and Association of Child Life Professionals. And last but not least is Ms. Nico Wilson, is a doctoral candidate also at the University of Central Florida. She is currently working on her dissertation, which is examining fertility-related quality of life, relationship satisfaction, resilience, depression, and shame in diverse couples with infertility. She is a licensed mental health counselor, a nationally certified counselor, a certified specialist in mental health and learning, EMDR trained, and a certified clinical trauma professional. Her clinical work focuses on couples, complex trauma, and addiction. And she is an active member of ACA, AMCD, ACEs, and SACES. So Thank you all for being here with me today. I am so excited to see you all and to have you kind of just communicate with our public here as to what's been going on with you all and what kind of advice or kind of concerns you have for the community as large when it comes to the things that are happening around this election cycle. So my first question to you all, and you can answer it however you like, is how you doing? What's going on? How you feeling? All right, you all gonna be quiet. I'm gonna go with Aaron. Go ahead,
No.
Go ahead, Sheldon.
That's a tough one. I think the majority of this past week has been kind of numb in terms of there's just a lot of uncertainty and in terms of kind of how we're moving forward. And so it's just been kind of a wait and see game. And so trying not to trying to kind of manage my hopes and manage my fears as I move through the week.
So when you say fears, what's going on? What are you kind of pointing towards when you say fears?
Yeah, when I say fears, I mean throughout this election cycle and being someone who engages in social media, you see and hear a lot of the hate that exists and can exist in the world. So just fears about just my identities and how people perceive my identities, and just moving through kind of hearing that language and hearing that hate and having to kind of care for myself and care for my circles as we move through this last week, but also, this last months and years.
Yeah, I hear you. And we'll press a little bit there a little bit later, but thank you for sharing that. Absolutely. How about you, Tianka?
Yeah, I was gonna go next. The question is, how are we feeling? How are we doing? I would have to say that I heavily rely on my coping skills because I would say morning, basically what I'm saying is every day is different, and then throughout the day it's different.
Okay.
And that has to do with my interactions and the things that I have to do throughout the day. So right now, I feel like community and being here is helpful. So right now I'm doing okay, but it definitely changes. And the other emotions or feelings that I'm experiencing, I would definitely say anxiety. And I'm very concerned.
Okay.
And then we can talk later. I think the other issue is my research and the things that I'm interested in. It's around advocacy and allyship. And so I'm really immersed in it. So it's a constant, my mind is constantly going. So I'm just exhausted too. So.
Exhausted. So you said concern. So I gotta press there for a second. What are some of your concerns?
Yeah, I chose concerns because Sheldon said fears. So so to be fair, I have fears as well, but I chose concern intentionally. My concerns are wrapped around, I think similarly, Sheldon was talking about his inner circles and his communities. For me, same thing. The work that I do and my goal with working with students, and then also what I'm currently doing, and then my family and myself. And so to be transparent, I've been a Black woman all my life. And I say that because some of the things that are coming up and that are heightened have been happening, to me for a very long time. And now that there's different exposure around racism, and I think Sheldon used the word hate, it's a daily thing for me personally that I have to manage. So that would be what I meant by concerns.
That's fair. Bethany, how are you? What's going on over there?
I would say it's a mix of a little hope, a lot of anxiety, just a lot of, I like control. I like to be able to know what's coming. That's not happening right now. Okay. And so the word Sheldon used was manage. And I feel like every day I manage. I manage a little differently each day. Some days I have to manage and pretend I'm not a grad student and take care of myself. And other days I manage by, okay, I've got to do the work. I'll work on emotions the next day. And so it's surviving, managing, figuring out, not knowing when this is going to end, and figuring out how to continue moving forward, but also taking care of myself.
So you've always been taking care of yourself in some regards. Do you feel as though you have control of that, or is it is that part of the angst, the anxiety that you're feeling?
I would say there's no control right now. But I would say that I have allowed myself to be okay with that. And so some days I can have great coping mechanisms in place. And some days I have to give myself grace and say, I don't have enough right now, so I just have to be, and that's okay. That's not that I failed myself. It's just that I'm giving myself permission to just be. As a counselor, we know all the right things to do, all the right things to say. We tell them to our clients. We also tell our clients to be gracious to themselves. And I'm learning to be gracious to myself in all of this.
Very nice.
So, yeah.
That's one of my new favorite words, grace. Just giving yourself grace. And Niko, how are you feeling? How are you doing?
Hey there. Thanks for having me on today. I think I can resonate deeply with what has already been shared about that kind of that balance of feeling anxious and stress, and also you have things on your plate that have deadlines that you need to focus on, and kind of being able to decide when is it okay to have that grace in that space, and when is it more important that I'm available offering that space to somebody else, and when do I actually need to focus on my statistics for my dissertation. So I think during this period, and I heard some others kind of share this, that some of the coping mechanisms I normally use don't feel to be as helpful right now. And so, right. So almost allowing myself to be okay with that. And maybe that means that I have to just sit in silence for a little while, or I need to redirect my attention to something else. So it's a balance of trying to get through the day and also, take care of yourself. And like Bethany said, as counselors, we know what we're supposed to do. The challenging thing is, even for us, when that doesn't work because of the level of stress, we have to be okay with doing something different and being okay with that.
Nice. And so when you go to that space where you're going, and you said you kind of sit in silence, to me, I think of meditation or mindfulness. Is it silence, or is there just a lot of stuff that's still kind of going back and forth in your head?
Yeah, I think it's mainly a lot of stuff keep going back and forth in my head. As with meditation, you always kind of bring yourself back, right? Bring yourself back to that center. And sometimes that means every couple seconds you have to remind yourself, like, no, I'm supposed to focus on my breath. But to be transparent, I think a lot of that ends up looking like just trying to sit still and let my nervous system calm down before I move on to the next thing.
Nice. I appreciate that.
Yeah.
So there's a word that I want to throw out there to you all, and it's really something that I think is happening. I mean, if you watch anything on TV in the past couple of days related to this election, there's a lot of skepticism that's out there. So what are you seeing, and how are you feeling about skepticism, and what would you say to those who are kind of skeptics of the process? This is the stumper. Go, Tianka.
I'm not sure if I'm going to answer this down the right path.
Okay.
But if I put myself in that kind of position and thinking about what you're talking about, I would say personally that we kind of have to go inward. And I don't mean inward as in like isolation, but kind of just going inward and
reflective.
What was that? Yeah,
Reflective.
reflective and like, I don't want to use the word centering yourself because I know we were talking about mindfulness, but I really mean going inward and kind of evaluating, yeah, and reflecting. And I'm just going to kind of leave it at that because I could take it down a different direction. But the first thing I thought of was that's kind of what I have to do for myself is go inward and evaluate and reflect so that I can kind of have an opportunity to balance things out with different perspectives.
So we don't have to go there, but where would that left place be if you had went there?
No comment.
Okay, all right.
At the moment, I'm still trying to articulate my thoughts.
Okay, excellent. Who else?
If I could give another word to skepticism, the way in which I was kind of thinking about it as Tianka was speaking and as you asked the question and as I've being very transparent, I very minimally have engaged in news recently because I just don't want to invest in the foolery that has been existing. But a piece of how I am moving through this, and I hope others work to move through this as well, is in what ways are we engaging in compassion? And what I mean by compassion is in what ways are we working to understand the other's experience, however you see other. How are we working to understand that other person, that other community, that other family, whomever, rather than engaging in skepticism and criticism and as I said earlier, hate. So that's kind of where my thoughts were going.
Right, yeah, especially like when you feel as though you're not getting it your way, right? If the things that you have put into place in the way that you see the world is not lining up in that way, kind of giving yourself that opportunity to kind of step out of it.
I think it's, I think it's really hard, and I'm included in this at times. It's really hard to look outside of ourselves and to put ourselves in other people's shoes. Especially if we're not engaged in that otherness in our day-to-day experience. And so I think right now is especially a time where we have to, as Tianka was saying, look inward and really push ourselves to step into the other person's shoes so that we can engage in kindness and consideration and compassion rather than criticism and hate.
Thank you for that. Thank you.
I have, thank you both for sharing that. I resonate with some of that. And then I have a little bit, I guess, I might sound a little nerdy here for a second, but I've been thinking about this word skepticism. And I think oftentimes it has a connotation of being negative, of course. And I think that the kind of the definition behind it is like questioning the truth around beliefs, not absolute truth, just both people's belief systems or a culture's belief systems. And so I think that there is harmful skepticism, and I think that there's healthy skepticism. And I think the harmful kind is like what Sheldon and Tianka both referenced, is when it's not met with empathy and you don't believe the lived experience or the truth of somebody's story and what they actually are telling you. Like, that is not a time to be skeptical. That is a time to learn and to listen. And it can be harmful. On the flip side, I think that there is a healthy type of skepticism where when things are thrown at us, maybe like on the news or media or anything, do we just believe it? Or do we just say, oh, well, this aligns with other things that I believe, so it must be true. And in those instances, I think it's really important to be skeptical or to do your research. And this might just be the doc program that has put that in my brain for so many years, but it's so important to really do your research and to trust that, to trust data, to trust numbers, to trust also your intuition from what you're learning from those things. And so on one hand, I think on the personal level, skepticism is really harmful. And then on the grand level, I wish that more people would be doing that and be more
discerning.
Yes.
More discerning.
Yes, absolutely. Which I think that might be the positive way, like the positive connotation of skepticism or curiosity, as I've heard some others say. So yeah, it's mixed, because I do think that there should be more learning, more discernment, more investigation, maybe, when it comes to the grander like belief systems.
Excellent. Thanks for sharing that.
Yeah.
How about you, Bethany?
Have to go after Nico.
I know sometimes we have those woes. I'm sorry. Don't be too skeptical about it, though.
No, some of what Nico just shared is something that I was thinking. I'm so wanting people to critically think right now. I think it's imperative that people critically think. And so I think this is an opportunity for all of us to critically think, to consider what others may experience that I may not experience, and that's okay. And to understand where someone else is coming from that is different than myself. I get that opportunity every day when I counsel. I get to see someone else's perspective. It's an honor that I get to have as a counselor. And I think now humanity has an opportunity to engage in critical thinking and being open to listening and considering that just because you haven't experienced it doesn't mean it doesn't happen. And so, yeah.
That's a great segue into that whole piece about walking in somebody else's shoes. Just because you haven't experienced it, doesn't mean that it's not true, right? It's not something that somebody's having to deal with in their life story. As counselors, how do you, in terms of what you're going to be getting yourselves into with this dissertation, and then when you move into the realm of a counselor educator, how do you talk to students and maybe the communities and be an advocate for people learning to walk in other people's shoes? I mean, what do you see your role as a counselor educator in that respect?
I was gonna allow someone else to speak first, but then I was like, "Oh, the silence."
That's a counseling.
I think a great.
Right? People
is.
say that counseling makes the silence just makes somebody feel that they got this burden they have to get off their chest. Okay, go ahead.
A great lesson that I learned in my master's program, and I think it speaks volume to when I think about advocacy and working with students, is that I feel like it's my opportunity and my job to help students learn and understand how to get comfortable with being uncomfortable. Because I think if we're going to step into someone else's shoes, if we're going to work to understand someone else's experience, we have to acknowledge that that's going to be an uncomfortable experience, that it's going to feel like you're going kind of against, sometimes it'll feel like you're going against the grain of what you've known to be true, or it'll make you kind of question lessons that you've learned throughout your life. And it's so important that we discuss and talk about how to sit in that discomfort if we're going to, or if I'm going to teach students how to be advocates, was my first thoughts.
Other thoughts?
That silence again. You just gotta jump in. That was really great, Sheldon. I resonate with that. I think I've said the word resonate every time I've answered a question, so that's good. But I can. And the first thing that comes to mind is that, like, as a counselor and a counselor educator, we are more than professors, clinicians. We're modeling behavior in many ways, and we're mentoring students, which can allow you to kind of get to that deeper, maybe more personal level, as opposed to just kind of the distance that sometimes we feel with our clients and our students. And I think for me, particularly as a white female, I have a responsibility to model what it looks like to continue to learn and to continue to unlearn and to continue to challenge students to grow when it comes to empathy and stepping into other people's shoes. The reality is that being my personal background, being raised in a Hispanic culture, but being, being white, there are many shoes that I am not in, and I will never be able to fully understand what it's like to step into that person's shoes, but I can continue to learn and to listen and to fight for students and to do that as they become counselors. When it comes to clients, I think it's really providing a space of openness and care and all that, Rogerian stuff for clients to feel safe to share their experience first, right? First, I have to be safe. Then you can share that experience, and then you can permit me to learn from that experience. So I think there's a lot of layers to that, and I hope what I'm saying kind of makes sense. But I think it's, especially in our current times, it is so necessary and important that as we're developing as counselor educators, and our program does a great job of emphasizing this for us, is how to be those advocates and allies and mentors, and to model those things for
You
students.
said something that, that I think is so rich in terms of having a self-awareness about how you fit into this circle, right? And so when we are advocating for folks to kind of know who they are through their whiteness, through their blackness, through whether they're Hispanic or Asian, when we're asking you to kind of understand that and see that in retrospect to all the other things that are happening in the world, it doesn't mean to deny yourself. No one's saying deny who you are, but making sure that within that you recognize that there's an interconnection there, right? And when you come into the lifespan of someone else, there's a ripple effect. And if we don't understand that and how we impact each other, then we damage whatever kind of progress we can have, because we then, again, it goes back to, there's a thing, right? Be introspective doesn't mean be selfish. And so that's kind of what came up for me when you were talking just now. Tianka, I see you coming through.
Yeah, well, because Dr. Butler, before you went, when Niko was sharing, something came to my mind about community, and I'm going to go to that in a minute. But just to kind of segue into what you were saying, as far as self-awareness and the connections that happen, it's really important to help people be seen. I think sometimes in letting them know, like, I see you, and what that means and what that looks like as it relates to advocacy, as it relates to being in class and connecting with your students or students connecting with each other, where you're really being intentional about hearing what that person is sharing and letting them know, I see you. And maybe you don't understand it and maybe you don't agree, but I really think it's important that that piece of I see you and I hear you happens. Yeah. And so the next piece for me, when you first asked the question, I hesitated because I didn't know if folks were going to understand what I meant. But I really think community is important, getting involved. And so, like, for example, maybe I don't know much about a different community and I'm not as involved. And this is not for everyone. Advocacy, the way folks advocate, different folks have to do it to their, to their best expertise and to what makes them feel most comfortable. That's how I see it. I know people should be comfortable with being uncomfortable, but sometimes when it comes to advocacy, you really have to hone in and focus on what you're best at. So going out in the communities might not be for everyone, but the way that I see it is really immersing ourselves in different communities, and that will add to us being able to advocate and make those connections more authentically with folks.
And right, and so sometimes it's not even interacting, right? So you might not be able to get there. You might not be able to be a part of that community, but to expand your mind, to kind of be open to the fact that, there are other things that are being experienced, and that doesn't make it bad, right? It's just a different way that people are experiencing life, right? And being open to that. So I appreciate that. I appreciate how you're framing that as in your frame of reference, so to speak. Anything else? Anyone else?
what comes to mind as a future educator for myself is being vulnerable. Showing my students that I'm not just asking you to do the work, but I'm going to do the work as well.
Nice.
So we are together going to go on this journey and grow. And so every time that I have an opportunity to teach, I feel like I grow because students stretch me and they challenge ideas, which I welcome in the classroom. And I look at something in a different lens and I'm like, oh, that's how you're approaching that. Okay, now let's see how that fits with theory and all the things that I'm teaching. But just that I'm going along the journey and it's not me versus them, but we're in it together.
Nice. I appreciate that. I'm going to read something to you all. I'm going to turn my gaze away from the screen for a second, but this is why it's important that we do the work that we do. And I was at the University of Missouri in St. Louis before I came to UCF, and that was almost 14 years ago. A student sought me out, found me on Facebook, and sent me a message. And so I'm just going to read it real quick. So you were my professor when I was getting my counseling degree at UMSL in 2008. In one of your classes, we went outside and you had us line up side by side. You read a list of life experiences and privileges, and we had to step forward when we experienced them. I didn't truly get it then. I do now. I'm taking my 3 white sons to protest, reading books by people of color, donating to bail funds, supporting Black businesses. I know I deserve no pat on my back because of it, because it's the right thing to do. I'm sorry for my ignorance and unacknowledged racism at the time. I think of this class often, and I hope you will, I hope you are well, right? From the bottom of my heart, you influenced me. And that's why we're here. What comes up for you hearing that? And what legacy do you want to leave for the students that you're going to end up teaching, or the students that you've already had an impact on in your life?
I am going to share after. I just want to say that was really, that kind of hit my heart a little bit. So I'm still kind of processing that message.
It brought me back to in my undergrad and master's experiences. I worked a lot with student affairs at my university, and the activity that you described was cross the line. And I did that activity often with students, and it just brought me back to experiences and conversations then, and I think about those relationships at that time, relationships now, and the legacy that I want to leave. And I think it really is based in aiding someone's growth and development. And that can be in many different ways. But I really think for me, it's aiding someone's growth and development socially. To my core, my undergrad degrees are in sociology and psychology, and I definitely spent more time in the sociology program. And it's really impacted my belief in a part of our jobs as humans is to work to understand the other humans around us. And I hope that my legacy is that I hope students and clients work to understand the other people around them, and that they also challenge me in my understanding of the people that I'm engaging with, kind of how Bethany was saying, that she's consistently learning and growing with the students that she's working with. So when I think about legacy, I think that's what I want, is that I'm constantly learning and growing with my students, and that they're constantly learning and growing about the world that they're engaging in and how they're engaging in that world.
Yeah, so I definitely say all the time, I don't know it all, and I'm learning just as we go through this, right? Every single day, there's something new that we are learning and picking up on. just from, you think about pronouns, or if you think about the word that comes to mind right now is intersectionality. I wasn't talking about intersectionality 10 years ago. These are all new things that you got to continue to be out there on the forefront. And so when Tianka was talking, or when you all were just talking about, leaving an experience for your students, or people being able to step into somebody else's shoes, you don't have to go into their communities all the time, right? That was that exercise. That exercise was about experiencing what it might be like for someone else, because you don't have the opportunity to immerse yourself in their communities. But at least if you can kind of have some grace about it, you can kind of change your way of thinking about how others are really living in this world. And so other thoughts that come up for you all.
For me, I think it's that we may never know the impact that we will have, and that's okay. That we still should do what we do and not be discouraged. That we don't know. We're planting seeds, we're giving opportunities, and then it's up to the individual to choose what they want to do with that. And it's our job to give those opportunities of growth. And so for me, that takes a little bit of weight off my shoulders. It's still very humbling and still a very large task. But I offer these opportunities of growth and then hope that students will accept those opportunities. It took a while for your student to take that experience, and it eventually resonated with him. And my hope for humanity is with time and with repetition and with continued experiences that we can all grow.
Yeah, that's powerful. That's really powerful.
Bethany, I think first, thank you for sharing that as far as explaining how we may not always know, but to kind of stay hopeful that the work that we're doing is, having an impact. I share that because I think it's something that comes up for me sometimes is it gets really hard just because of my own identities and the things that I'm going through. Sometimes where I want to pull back, but I need to keep going and making sure that I am continuing to make an impact and continue to do the work that we do. And so when we think about Dr. Butler's message that he received, and then what you said, Bethany, about we may not always know, or we may not always see it, but we know we're making that impact later on, that's what pushes me to keep going. And full transparency, I've had things come up recently that were really heavy, where I was like, oh gosh, do I keep going and trying to be an advocate and speak up or not and take care of me? And then I'm reminded, no, this is gonna make a difference, and I need to keep going. So not really answering the question, Dr. Butler, about legacy yet. As a first year doc student, I'm still working on what that might look like. But I just wanted to share when Bethany was saying that we may not always know, that's something that I hold on to that helps me to keep going and knowing that, no, this is important.
Well, even in our work as counselors, right? We have to kind of regiment ourselves to believe that we're doing the right thing and we're doing good work, because we never might know how our clients are faring after they leave our care. And so, and so when you get those little sound bites every once in a while, it really does resonate, and it does make you feel like, okay, for all those tough times, just that one response made it okay. That I had to go through those rough patches, that I had to have those evaluations that told me that, hey, I sucked as an instructor. But when I see someone who says, years later, the impact of your words has really changed how I see the world now. And so you never know when you plant those seeds, how they're going to kind of grow and be what they are actually going to ultimately be in the lives of those you're sowing them for. So, it does come, Tianka. It does come. It does come. Few and far between. Yes, Niko.
I was just going to say that I think everybody is spot on 100%. And I can deeply resonate with the client perspective of that, of like, you don't know, that what you did was enough, but you hope that it is. And so you kind of have this commitment to doing your best and offering every student, even when it gets tiring, even when we have personal stuff going on, still showing up for our students and for our clients. And I think legacy wise, I've learned that although there is so much education, textbooks, skills that are important for developing counselors to learn, I think, like Sheldon said, that social aspect, that personal aspect of growing as a person, I would so much rather have students feel like they grew or developed or learned something new, even if that was through being triggered or being, I guess a better word would be emotionally reactive to something.
Right.
But knowing that they grew in some way personally is way more rewarding, I think, than even some of the things that, we have to teach, of course.
Yeah. So I like that. I'll have to try to figure out how to use emotionally reactive instead of triggered in the future. But I think that, always evolving, always evolving. And so let's trigger to self-care. And you guys talked about it a little bit when I opened up about what you're doing to kind of maintain, so to speak. But for those who are out, who are experiencing whatever types of trauma or things that are related to this, what are some kind of things that you would like to share? What's in your wheelhouse that you think people can utilize or go to kind of relieve stress or anxiety and things along those lines?
I have two things that I want to mention. In the first one, I think Niko was talking about sitting in silence, or sometimes she just has to sit still to be able to transition to her next task. Something for me, and this might not sound like a very self-care-y thing, but really acknowledging what I'm experiencing and how I'm feeling, instead of trying to just keep going and saying, no, this hurts and this is hard. And I'll use an example. I typically am very active on social media as it relates to hot topics, and really my goal is to connect with other people and really have these real conversations. So I'm very intentional about what I post and how I interact. I say that to share that when I started, as a first year doc student, I had to move away and kind of not be on social media at all. And I was disconnected. And it was because I was trying not to acknowledge specifically what was happening with Breonna Taylor's case. I was really struggling with that. And I was trying to not acknowledge that it was really making me feel some kind of way. And so what I ended up doing was probably a few weeks ago, I took a weekend and I kind of went into it and acknowledged, this hurts, this feels some kind of, it's making me feel some kind of way. And as I was acknowledging it and sitting in it, kind of like what Niko was saying, it helped me feel better. And of course, as counselors, we know this, right? Acknowledging and accepting.
Got to fight through the pain to get to the other side. Yes.
We all know this, but I just was trying to get through being a first year doc student as well. So I was pushing it away. The moral of the story as far as self-care is related is that disconnection from being away from social media was purposeful because of school. But what I noticed was I was disconnected from my family. So I've now scheduled FaceTime meetings on a regular basis. So I would say one of my top self-care tips is that you stay connected and you are intentional about making sure you're staying connected. So I've now set up scheduled FaceTime meetings. I'm in Florida, my family's in California. So I'm scheduling that time. And even with the pandemic, it's not like we're all out visiting. So scheduling that time to be able to connect with people who fill your cup up.
You talk about that, and I think about modeling, right? We have to start modeling for people that it's okay to not be okay, right? We're so busy trying to always wear the mask that, oh no, everything is fine. Nothing happening in my house. Everything is really good. But when we can release that, it's so freeing sometimes that we kind of give ourselves that grace. Again, going back to grace. Other things that you all doing for self-care, or what you would say to others to do for self-care?
So I'm gonna sound nerdy for a second again, and then I'll have a point.
Listen, you have never, ever in my life sounded nerdy. So
Oh,
I just want you to know.
well, thank you, Dr. Butler. So there's this concept of the stress response cycle, which is basically, we've all heard of fight, flight, freeze, those kinds of responses that we have in the face of trauma, adversity, stress. And what we don't often talk about is how do those end? We often talk about like what it's like for when you feel them and when they start. And we teach clients to notice those experiences in their body, but we don't often talk about like, what is it like when it's over? And so something that really interests me is this topic of that stress response cycle. And the gist is that when we have this response, whether it be fight or flight, that adrenaline's pumping, maybe it's a bad phone call, or it's something on social media or the news, or just something that, is coming up from the past and we're sitting alone with it and it's just popping up. We need some kind of resolution. And that resolution can be comfort, it can be rest, it can be expression of some kind. And so that looks different for everybody. So I would encourage others that when you find what that resolution is for you, to really notice like, okay, I went through this stress experience, I need to do this thing to kind of end that whole cycle. Otherwise, we as humans, because other animals release it really fast, but we as humans kind of keep that absorbed in our body. We just keep thinking about it and thinking about it and thinking about it. So instead, that might be going for a run, just getting all that adrenaline out. It could be just weeping and letting out the tears. It could be connection with others, like Tianka was saying, or it could be just sitting in silence, journaling. There's a million things that it could be. But I think just recognizing that we need to have that resolution where we come back and find that center or find that comfort or rest. And really, I think the big word is like some kind of safety. We just come back and we find that safety. Okay. And that can be different for everybody. So that would probably be my biggest.
So I found that as very, very educational. There was nothing nerdy about that whatsoever. Well, maybe slightly. Well, no, there was nothing nerdy about that at all. Thanks. Yeah. What else is going on for you all?
I would say that something that I've reminded myself is that we are in trying times and they're going to continue. And so because of that, and because there's so much we can't predict, that if we try to plan too far ahead, it can become very overwhelming, because that's also within the chaos. And so very much being in the present moment and today, what am I going to do today? How am I going to get through today? And not having, I'm a planner, but I've let that go because I need to focus on today. And what, like the American Red Cross and different organizations that have traveled across the world to traumatic events to support people, have realized they used to come in with interventions and doing all this stuff, but they realized that actually is causing harm, because we just need to get back to the basics right now, and we just need to survive. And so I remembered that training that I had taken, and just reminding myself that this isn't time to do deep work. This isn't the time. It's time to survive and do things that are healthy for me. And I'll do the work later on. There will be work to be done, and it's important for me to address it then. But right now I need to get to Saturday, and then I need to get to Sunday.
And in a very real sense, that's a plan, right? It's a plan. And so while you have to kind of refocus and reframe some of the things that may have been in the past for yourself, for me to get through this next day, to get to this next week, to get to this next year, I have to do some things a little bit differently. And that's my new plan. So that's wonderful. Thanks, Bethany, for sharing that. Sheldon, anything?
Yeah, I don't know if I have too much to add, because what everyone said was kind of what was going on my mind. Let
me just say that you're really new to the program, and we have Niko and Bethany, who just, they're stellar, right? This is what we are.
They're incredible.
Of course, you would not have much to share following that, because that's what we do. That's just what we do.
But I think to maybe summarize it all is that when I think about coping strategies, when I think about wellness, when I think about self-care, it all comes down to how are we being intentional about doing what we need at this current moment in time, and being honest with ourselves about what we need. Like, you know, as Niko was saying, sometimes what we need is to cry, but we tell ourselves like, nah, I got to push through. I got to get through. I can't let those tears fall.
And not only that, the voices in your head who told you not to cry are also telling you not to cry, right? And
yes.
So stand up and cry.
Right. And so I think we have to be honest with ourselves in terms of like, if we have all this stuff and we know we need to let it out, give care to yourself, give love to yourself, give worth to yourself, and let that stuff out. If you know you're someone that engages in physicality to let stuff out, then go for that run, go for that personal record in the gym.
Yeah.
I know for me, I've found an immense amount of solace in desensitizing. So when I shower, I turn off my lights and I light candles, and I'm a really big music person. So I put on music that is oriented to kind of what I'm feeling at that time. And just that showering space really helps calm and soothe and let out whatever I need to let out.
What was the last song you played?
I was listening to some more somber music today. And the last song I listened to was Remedy by Adele.
Okay. Remedy, yeah. I thought you were going to say something by NWA or something.
No, Anger was 2 days ago.
I'm just kidding. So listen, we're coming to the close of this hour. It went very quickly in terms of that, but I want to kind of do something to check out. And like, you came in with anxiety and you came in with the ways that you were feeling and stuff along those lines. Where are you now? How are you? What's going on in your minds? And, you know, was there anything that kind of resonates with you in terms of what has happened over this hour with you? You know, this is so funny because I'm going to tell you before you even go anywhere else with this, you're reminding me of being back in the classroom when I ask questions of my students and they sit there. And so this is really good. This is just good for my soul. I appreciate it so much.
I have a question about that, Dr. Butler. Don't you think it's great, though, that we're trying to be intentional and thoughtful with our answers?
Oh, it's beautiful. It's beautiful. It's absolutely beautiful. But like I said, it's just a reminder of, you know, that's why I knew that everything that was happening was for a reason and was right? Because this was supposed to happen. It was supposed to happen in the way in which it goes. So you can't rush the process.
Well, I really appreciate your platform and appreciate you, Dr. Butler. I just have one quick thing. It goes back to what part of my self-care, one of the things that I do, it's just a reminder about connection and community. So a reflection of thinking about what everyone said and being able to be part of this, I feel connected. And then I feel like I'm brought back to this idea of how important community and making sure you stay connected. So I just thank you for that.
Thank you. Thank you. I'm glad you responded to the email.
Yeah, I was thinking kind of along the same lines. The first words that came to mind was lighter, but I didn't quite know if that was right. But hearing Tink, it's very much just remembering how fulfilling it is to just connect with people on a genuine and authentic level and about what's happening with us and what we're experiencing rather than the like fun, silly, surface level stuff.
Yeah.
Even though that stuff is important,
yeah.
I think this stuff also has value.
No, definitely. Did you just say Tink?
Oh, I'm sorry. Did I just give away your nickname? I thought you might.
No, wait. No, I was going to go there, and don't be sorry because I never got the privilege of understanding the nickname, and so like I have to always say Tianka all the way out. You saying there's a nickname? There's a lovely nickname, Tink?
My bad.
Oh my goodness.
Comes from I introduced myself like that in class, and Dr. Butler, I haven't been privileged enough to have you as my friend. So
okay, I'll accept that. I'll accept that.
That's awesome. I love that nickname. I think I also just feel really thankful to have been a part of this talk. I was so it might sound cheesy, but I was so honored when I got the message from you, Dr. Butler, that you would, even consider wanting me to be on this. I really appreciate that. And I think it is encouraging to be around others that are in a similar context with school and still be able to kind of talk through what's really going on. And I think everybody was really real. And that's what I appreciate, because we're all working independently. I mean, this is the most I've ever talked to Tianka before, so like I love this opportunity as well. And then otherwise, I think I also learned a new self-care method, because I'm going to try that shower, Sheldon, with the music.
I know, right? I'm sitting there thinking, I gotta go buy candles.
I know.
How about you, Beth?
I feel joyful to be my authentic self with others. I felt like we were all genuine, and it was safe to be genuine in this group, and that we were truly sharing from our hearts, and that just felt good. We're not getting a lot of that through connection right now, and it felt good to learn from each other and your experiences, and to hear how you're doing as well, all of you. It was good to hear. So yeah, it was a privilege to be here.
That's cool, because it doesn't have to always be in the classroom. Exactly. So anyway, I want to thank you all for being a part, for taking up the charge when the call was made. And so it's been fun. And the other thing, and the piece of the puzzle is, I know the beauty of what counseling does and what it can do for the community. And I'm not with you all because I'm over in the Office of Diversity and Inclusion. So I don't get to see you and have the experiences like I used to have when I was actually teaching in the counselor education program. And so this has really been, helpful as well in terms of getting to even see you and talk with you and know you. I've had instances with each of you over the years, so to speak. And so we know what those relationships have been. But I think that, seeing you in this light, and also because I knew who you were in the first place. So don't feel honored that you got the email, just know that you got the email because of who you are. And so that is really the piece that I want you to go away with and resonate with, because that is the power of what you bring to the table as well. And it's not about this platform, but about what you're doing and how you're shining your light. And I think that's really important for you all to take in as well. So that brings us to the end of this hour of Matters of Diversity with Dr. B. And I really appreciate you. Appreciate those of you who kind of came around and kind of hung out with us. Invite folks to our YouTube channel and subscribe. And, we are going to have shows weekly. And on this upcoming week, we're going to be talking with some veterans about how it is to be a veteran in the United States, especially in this day and time. And we're going to also talk with other students on next Friday. So always, it's going to be a platform for us to kind of just be here and to give our spirit. So thank you. I want to also thank again the UCF Foundation Office for their support of us and sponsoring our program. And just continue to do what you got to do and find grace. Each of you and everyone out there, find grace, because we'll get through this. There's no other thing for us to do but to get through it. So with that, I say goodbye and thank you again.